Discussing the hip joint, whenever we describe the hip joint, we say it is a ball and socket type of synovial joint, multi-axial. Articulating surfaces, we always write superior-medially there is acetabulum. Not only acetabulum, there is acetabulum, the lunate surface of acetabulum, there is notch and the transverse acetabular ligament. Inferior-laterally there is the head of the femur. When we talk about the capsule, in the capsule we say the capsule is attached superiorly to the borders of acetabulum, acetabular labrum and the transverse acetabular ligament superiorly. Inferiorly, it is attached to intertrochanteric line anteriorly and it is medial to the intertrochanteric crest posteriorly, not attached to intertrochanteric crest. There is one opening to bursa deep to psoas major. The ligaments of the hip joint, you have to remember 3 plus 3. These 3, they come from ilium, ischium and pubis. The ligament coming from the ilium, it comes from the anterior inferior iliac spine. It comes from the anterior inferior iliac spine. This is the Biglows ligament. It is inverted Y-shaped ligament. This is the strongest ligament in the body because the line of gravity passes behind. The body has tendency to fall backwards. This ligament stabilizes. So anterior inferior iliac spine to intertrochanteric line. The coming from ischium, it comes from ischial tuberosity and it merges with the circular fibers of the capsule. That's what reminds me that in the capsule, whenever you write, you have to write there are 2 types of fibers, retinacular fibers which are vertical and zona orbicularis which are circular fibers. So ischiofemoral ligament merges with the zona orbicularis which are circular fibers. Pubis, the pubofemoral, iliofemoral, ischiofemoral, pubofemoral. Pubofemoral ligament comes from the iliopubic eminence, and it merges with the lower band of iliofemoral ligament. Pubofemoral ligament merges with the lower band of iliofemoral ligament. It starts from iliopubic eminence. Then there are 3 ligaments. Remaining 3 ligaments are restricted to the acetabulum only. Acetabular labrum, transverse acetabular ligament and ligament of head of femur. So that's all about hip joint, its capsule and ligaments. So now the movements happening at the hip joint, flexion is brought about by iliopsoas and rectus femoris, extension by gluteus maximus and hamstrings, adduction by adductors, gracilis and pectineus, abduction is brought by gluteus medius and minimus. We also bring about medial rotation. Lateral rotation is brought about by the short lateral rotators, the superior gemellus, obturator internus, inferior gemellus, quadratus femoris, also the gluteus maximus. In applied anatomy, the first point you need to write about is congenital dislocation of the hip, which is very common in small children. Then tuberculosis of the hip joint, arthritis of the hip joint, knee joint. If you don't remember any applied, you have to write replacement. In chronic arthritis, we have to go for hip joint replacement, which can be partial replacement or total replacement. First year में इतना मार्क मिलेगा, third year में 0 मिलेगा इसको. Okay. Then knee joint, because of arthritis, people suffer, and then we can go for knee joint replacement, where artificial process. And then with the muscles, there is this Kendall-Burst test. Okay. Thank you.